Hi folks, Mike here again. Thanks for checking in with me. First, I have a bunch of questions about the questions that I'm answering. First and foremost, Stephanie, actually our manager, asked me if some of them are made up, like the boa constrictor one. The answer is no, they're not made up. I've got some real doozies bigger than that one. But as my dad, dear old dad, used to say, sometimes truth is stranger than friction, and in this case that's true. Now related to that, I don't know if you noticed this, but I read about it. 4 days ago there was a salmonella outbreak, which I had spoken about with the snakes and turtles, etc. In a multi-state area. I think like 30 plus people were stricken with salmonella. About a third of them were children. Nobody died, but a number of them were hospitalized. So it is out there and is pertinent. The other question that people asked me was, is this first come, first serve? If I get my question in first, you answer first, and the answer is no, I don't. I try to answer pertinent questions. Not all of them are pertinent. I'll give you an example of the questions briefly as well. And just so you have a history, we had this website since 2001. That's how long we've been open. And then we started getting questions like one a week, and then it turned into one a day, and then it was 10 a day. And it got so that there were so many questions coming in we couldn't answer them. I actually had to shut down the question page, which we recently opened up. So I have like a bank of at least 500 questions, probably more than that, that I never even have had a chance to answer yet. The other thing I wanted to clarify with you too is this is not my personal rant page. My goal was to disseminate some information that will help you with your children. It should be objective data that can be backed up with reliable resources, and that's why I'll reference American Medical Association or American Academy of Pediatrics. Sources that in the Center for Disease Control, which I had done a few weeks ago. So you can double check me on the things that I'm telling you from reliable sources, and this doesn't turn into my own personal opinion page, because it should not be. I should be giving you reliable information, objective data that has been historically proven by a number of doctors and scientists and historians that you go back and check and say, I guess Mike knows what he's talking about this time. If I do give personal advice, it's not as a doctor or a health professional or a medical professional, it's as a father or a husband. But those are two distinctly different subjects. So keep in mind, I should be held accountable to be objective to you and give you good information, not just my personal opinion. So now I'll give you a flavor of some of the questions that come in. Some are pertinent, some aren't. So that's why I don't answer all of them. And some are like repetitive, like I've answered it a few years ago and I answer it again and answer it again. So I'll give you an example. A few examples. One is, how tall will I be? That usually comes in from kids. Or how tall will my kids be? How old are you? Irrelevant. This probably came from my brother-in-law, but you never know. Do you like blondes, brunettes, or redheads? I like people of all color of the rainbow. Although I think I once dated a girl with blue hair. Not like blue troll hair, but like a blue tint. You know, very fine, a hint of blue. And then some of these questions get into my personal opinions or emotional answers, like this isn't really personal, but do you believe in the death penalty? How can you work in an ICU where children die? That's not really a personal question, but it's a very deep question. I don't really think I can answer that. I mean, I could answer it superficially, but I honestly, I don't think I would have a presence at this point in my life to answer a question like that, honestly. So that's the flavor of the questions. Please feel free to submit whatever questions you want through the website or Facebook, and continue to give constructive criticisms if this is helping or not. And I'll continue to do it if it helps people. Like I said, if not, then just let me know. So on a side note, just an update. Remember, I was going through the whole potty training with our son, and we have some great news. He started wearing underwear. Batman, Superman, take your pick. I don't know what he's wearing. Unfortunately, now he poops in the underwear. So we took 2 steps forward and 3 steps back. It has come to the point that I had to have an intervention with him. If I can, I'll post that as well shortly, and you can actually watch it yourself. That's it for this week. It's a weekend holiday. We're just taking it easy. So if you have good questions, please submit them. Thank you very much. Please be thankful for what you have. Have a great holiday, and bye-bye.